Welcome everyone to a very special webinar on creating a value proposition for TeamSTEPPS, how your frontline and your bottom line can both win. Lovely title. I think it's so creative. Shout out to Rhonda, our speaker today, for coming up with that. But my name is Jen Braun and I direct the AHA team training program. Thank you for joining us today. This is a slight continuation on from our monthly webinar series in January, February, March that really helped us focus on using human-centered design thinking in healthcare and specifically TeamSTEPPS. And the last webinar in March was about storytelling. And so, as in March, as in last week, I mean, and so this is really a bit more of we're taking that model that our partners at DoTank presented for us last week about how to tell that story. And we're going to role model that for you today. And so we're really excited to give you a little preview of some data and some insights on patient safety in general and TeamSTEPPS. So before we get started, just a few rules of engagement. Audio can be accessed either through your computer or through your phone. I'm going to go back here. Sorry. And so you can connect it either way. And so a Q&A session will be held at the end. So feel free to chat in questions throughout. We'll try to answer them in real time. If it's more of a conversation or a good discussion, we'll save that for the end. And then just know that this webinar is being recorded. The chat will not be included in that recording. And we will definitely share that link with everyone once the webinar is over. And so today's objectives, we're going to share with you the value case or the value prop for team training so that you can then take that and share that with your leadership. We'll highlight how TeamSTEPPS tools can help create that culture of retention and resilience at your organization. And we'll also provide you a bit of a sneak peek to some of the curriculum changes to our TeamSTEPPS Master Training course. So to continue on a little bit and to steal from our friends from DoTank and their webinar last week, just a classic pitch is made up of these components: setting the scene, stating the problem or challenge, providing the value proposition, explaining how the solution works, providing what critical assumptions you're making, outlining next steps, and making the ask. And so what DoTank shared with us and with our audience was a bit of a leaner version that we're going to role model here today. So throughout the webinar, you're going to see these 3 of the 4 categories outlined here very clearly on the slides. We're going to state the problem. We're going to share the big idea, which is TeamSTEPPS, and we're going to describe how the TeamSTEPPS will make a difference at your organization. And we're going to outline our next steps, or then you will outline your next steps and state your ask clearly back to your leadership. And throughout these 3 categories, we're going to lead with the head, heart, and eyes. So head meaning we're going to provide the data or the ROI and strategy behind things. We're going to also emphasize the heart. So really focusing on patients, the emotions, mission, value, purpose. And then we're going to lead with our eyes. So hopefully you'll see here that this is very visually appealing. We use a lot of images, a lot of data points, graphs. So keep that in mind too as you think about how you can adapt this for your audience, meaning your leadership team. So with that, I'm going to turn things over to our primary speaker today, Rhonda Fisher, who is our new team training clinical program lead here at the AHA. And she's going to walk through these 3 core categories for how to make your pitch. So Rhonda, over to you.
Perfect. So, hey, everybody. I am so excited that you are joining us today. And I'm excited because like you, I see the challenges before us in healthcare, but I also see real life, real time solutions. Just so you know, if you don't know me, a lot of you have probably heard from me before. I've been a nurse for over 30 years. The vast majority of that in the ER doing trauma. So I have, over the course of the last several years, I've done my share of time in PAPR helmets and behind an N95 mask And I've had the opportunity to have some really great conversations with the Frontline. But then in my consulting work, I've also had the privilege of sitting with leaders and hearing their stories and the pressures that you've been under the last 3 years. And can I just say thank you so much for having the courage to lead. It has not been easy. It's still not easy, which is part of the reason why we are doing this presentation today. So we're all aware of our pressure points and our need to solve them. We know that the last several years, we've lost some ground in patient safety, and we've got to rebuild that culture of safety. We know that our workforce is in desperate need of support. And we also know that the patient needs to start feeling more confident again in the care that we're providing them. And all these things are so intrinsically valuable in and of themselves, but even more so because they have a direct impact on an organization's ability to stay afloat in these uncertain times that we're in. I'm going to be drinking a lot of water. I'm so sorry. It's just my voice today. So, what I know to be true is there's not a nurse or a CEO out there that doesn't want to see safe and adequate staffing at the bedside. There's not a frontline worker or a chief nursing officer that doesn't want to see their patients getting great care. And there's not a doctor or a nurse or a unit manager or a chief financial officer, for that matter, that doesn't want to see both their patients safe and the people that are caring for them thriving. So when I have synthesized what I've heard from the front line and what I've heard from leaders out there, here's what I know to be true. We really want the same things. It might not appear that way at first, right? At first glance, it might appear that we've got opposing priorities, but it's not true. We really do want the same thing. And after doing the research the last couple of weeks on our pressure point, I want to just say again, it's possible. We have real life, real-time solutions that can get us there. So I want to talk about one of the clear solutions to our pressure point. So sorry. I did not know this was going to happen to me this morning. Anyway, before we start into those pressure points, I want to make sure you know that our premise here this morning is that team training has the power to move the needle on all of these pressure points. So rebuilding our workplace culture through a focus on team can make all the difference for patient safety, for our workforce retention, and for the patient experience. So I know these issues are multifaceted, and I'm telling you, we've got to be thinking outside the box on multiple fronts. I get that. So I don't think team training is the only answer, but what I want to tell you is that I'm 150% confident that it's one of the answers, and the data supports it. So just another quick caveat. Let me tell you what is and what isn't going to happen in the next 30 minutes or so. I've spent more than 2 weeks with my head in the data, doing the research, because I'm a firm believer that you cannot manage what you cannot measure. So I also think as a clinician, don't tell me that it works, show me that it works. So after 2 weeks, I had pages and pages and pages of data. And I started out by putting 3/4 of it on slides for you. And I thought, we will be here till next Tuesday. So what I'm going to do in the next half hour or so is just kind of give you an overview, okay? It's an overview. And then I'm going to make sure that afterwards you have access to all the data that I've collected so that you can take that data and you can apply it to the pressure points that you have for your particular organization. Okay, so let's drill it down. We know we're in trouble with our pressure points. So let's start with patient safety. The number of serious safety events reported to the Joint Commission jumped in 2021, reaching the highest annual level since this accrediting body started publicly reporting them in 2007. Ouch. The most commonly reported safety event, sentinel event, not going to surprise us, patient falls. In fact, the fall rate just in and of itself increased by 253% between 2019 and 2020, followed up by delays in treatment and then unintended retention of foreign objects. It's still getting us. In spite of all the work we've done there, it's still getting us. So I think that an article in the New England Journal of Medicine really summed it up for us when it said that pandemic associated patient safety declines. Pandemic associated patient safety declines erased years of promising continuing gains. We were making some progress on our issues. And then the pandemic came along and really kind of just pulled the rug right out beneath us. And what I need you to know today is that's costing us a crazy amount of money. About $1 in 10 dollars spent on healthcare is diverted to treating the effects of medical error. If you just think and start crunching those numbers in your head and think about just what that stat represents, it's crazy. Patient harm reduces global economic impact by trillions of dollars every year. That's what the latest research says. So let's look at the ways over here on the side that patient safety errors are adding up to lost revenue. And if you're in quality and safety, this isn't going to probably be any surprise to you. I think it's just a good reminder. So we know that sorry, moving my chat. Patient safety errors can directly affect reimbursement under our value-based payment programs. We know that patient safety errors can cause hospital to lose money under our capitated payment programs. That's because remember that errors increase the total cost of our pay. So if we're only getting a fixed amount of reimbursement, if we start sucking that up with lots of extra charges because of the errors that we're making, that's taking it right off that capitated payment. Non-compliance, we know this, non-compliance with accrediting agencies will often bring monetary penalties and fines. And then there's the lawsuits that come. It'll be really interesting to sit and have a talk like this in 2 or 3 years when more of the data comes in on what kind of lawsuits, legal actions we've seen patients and their families, and even our providers and some of our staff engage in because of what we've went through. And then there's that thing called patient leakage. Ooh, that's the reputational harm that can cause our patients to seek care elsewhere, right? So it only takes one bad apple to spoil the bear. You have a sentinel event and that patient or their family goes out and starts blasting across a billboard, and suddenly our patient volumes start going down just because of that reputational harm that's creating patient leakage. Now, I want you to know I have a lot more data for you on this. But before I move on, I just want to take a minute to introduce you to someone. This is my dad, and this is a picture of the ranch that I grew up on, the ranch that he loved until he was 58 years old when a series of medical errors took his life. So after 2 weeks of research and seeing the stats on medical air and its costs, it's incredibly sobering. But what I want to tell you today is it doesn't compare to the real cost, because behind every single one of those statistics is a name and a patient and a family whose lives have been changed forever because of something that we did or didn't do. So I believe in TeamSTEPPS because I know in a very personal way the difference that it could have made for my family. And you cannot put a price tag on that. So moving on to pressure point number 2. Pressure point number 2, our workforce resilience and retention. Ouch. Do we know that we've got a problem there? Oh, so sorry. 47% of healthcare workers are planning to leave their jobs by the year 2025. Ooh, nearly 1,400 hospitals, or 31%. This isn't a particular study that they looked at, and 31% of hospitals reported a critical staffing shortage to the federal government in January of 2022. Healthcare workforce shortages. They certainly predated COVID-19, right? But the pandemic has certainly intensified the issue, with as many as 47% of nurses planning to quit their jobs. And they're blaming that on burnout and that high stress environment. The number one challenge that nurse leaders are facing is the emotional health of their staff. That's according to a 2022 American Organization for Nursing Leadership longitudinal study. 47% of physicians reported being burned out in 2022. And those numbers were even higher for emergency docs. It came in at 60%, and critical care docs were at 56%. And I would say those are the two areas that really took a beating with COVID-19. So what are your workforce challenges costing you? Well, this is how it's hitting you personally. The turnover rate among nurses is up to 57% and up to 20% among nurse leaders. The average cost of turnover for a single staff RN, the average, it comes in higher in some studies, but the average is $46,100, and that's resulting in losses of anywhere from $5.2 to $9 million. And each percent change in RN turnover at your organization will cost or save the average hospital $262,300 every single year. Burnout related turnover costs in the studies that I looked at estimated that $9 billion for nurses. That's what turnover costs for nurses was coming up at, $9 billion, and $6.3 billion for physicians. Now, because that turnover is so high that we saw in the previous slide, it probably won't surprise us that contract labor expenses alone are nearly 500% higher than pre-pandemic levels. For every 20 travel RNs that you can eliminate, your hospital can save, look at that figure. What is that? I'm really bad at math. It's big. What is that? 4,203,000? Crazy. It's crazy. But again, moving on our head, heart, and eyes, I want to give you just a little story about how I have seen those numbers and those statistics on burnout and how it's resulting in turnover, how I have seen that retention and resilience issue come up really too close for comfort. I was at work this last year, and one of the emergency nurses, she was a relatively new nurse to our organization. She'd come on just per diem for us. And one day she shows up in my office. I'm doing some trauma work with her, kind of orienting to our trauma processes. And in the course of conversation, I just kind of watch her, how she's having a hard time focusing. And so I kind of just started to engage her on a more personal level. And she just started to cry. And I'm like, wow, I know this trauma stuff is dry, but it's not that bad. And so I started poking the bear just a little bit. And what I found out was that she'd spent the 2 years prior to that working in COVID ICUs on the front line on the border between Texas and Mexico. And every single day, she was participating in decisions like, who's going to get to have that vent today and who isn't? I've got so many patients and we are so short-staffed. How am I going to decide who's going to get my care today and what patients I'm just going to have to set to the side because there's just not enough of me going around? And the pressures that put on her. And really what she told me is, yeah, I'm here working casual call because I've got to pay the bills, but actually I'm leaving nursing. I'm in school for something different now. I'm getting out of healthcare altogether. I cannot take it one more day. And she was an incredibly valuable nurse, and she's not with us anymore. So, heart, it's hitting us in the pocketbook, but it's hitting us where it counts in our hearts as well. All right. So let's talk about patient experience, how the workforce shortages and our price points on patient safety, right? How is all of that affecting the patient experience? So first of all, we know that it's costing our patients in super practical ways. I've been a nurse out helping the last 3 years. And what I can tell you is I'm seeing lots of unattended call lights, lots of patients who are saying that their pain management hasn't been able to be addressed as timely or as effectively as they needed it to be. We've seen a lot of longer wait times and shorter visits as our physicians have been spread so thin. And then we also know that medical error has added extra hospital days to our patients. It's increased their pain and suffering. And it's had a big impact on our families as well, as those medical errors have unfolded before them with their loved one. And then there's the financial impact of the decreasing patient experience. Here's what one study that I found showed us, that organizations that deliver superior customer service tend to see net margins 50% higher than those that deliver not poor customer service, just average customer service. 50% higher for superior customer service. According to the research in this study, a hospital system with $2 billion in revenue, they would need to cut 460 jobs, and that's jobs with an average salary of 100K. Okay, they'd have to cut 460 jobs in order to gain the same 2.3% margin benefit that superior customer experience provides for revenue growth. So again, hitting us where it hurts. So we know, let me back up just for a minute. We know the extent of the problem. And believe me, I've shared with you a tenth of the data that I've collected and I'm going to make available to you. And after examining the data, again, I just want to say that I know this is a multifaceted issue, but my bold, brassy, lay it all on the line premise for today is I really do believe that team training through TeamSTEPPS can move the needle on our pressure points, and we've got the data to prove it. So let's jump in. Why does team training work? Why does it move the needle? Well, it's because team training at its core is all about culture. Culture affects quality more than anything else. Unit and department and organizational culture drives retention of workforce more than any other factor. And then culture propels the patient experience more than any other factor. So what I want you to hear from me loud and clear today is culture drives business success. You've got to have culture, you've got to have quality rather on stability. Let me back up. Stability, excellence, and all those factors, quality, resilience and retention, and patient experience. If you don't have stability and excellence in all three of those catalogs, you're not going to arrive at the business success that you need. So achieving a high-performing, a highly satisfying workplace culture, it should be at the top of our list. And here's the great news for you today. Here's the best piece of news for you all day long with all my stats. Cultural transformation is what AHA team training does best. It's what we do best. Yes, we use tried and true tools and concepts, but ultimately, I really want you to hear from us today. We don't sell a program. We sell cultural transformation, and that's what's going to get you to the goal. That's what's going to pay your dividends in patient safety, in staff satisfaction, and in a healthy bottom line for years to come. So just a quick level setting slide on what TeamSTEPPS is, if you're not familiar. TeamSTEPPS stands for Team Strategies and Tools to Enhance Patient Performance and Experience. It's based on more than 30 years of research on really high stakes, high risk environments like the military, aviation, nuclear power, places where if things go wrong, it's a really, really bad day at the office. And so finally in healthcare, we looked over our shoulders and we said, wow, those people are chasing zero harm and it's working for them. Isn't that something? Can't we apply those same tools and strategies in healthcare and get the same kind of traction? And of course, the answer is yes, yes. So what can TeamSTEPPS do for you in the year 2023? Well, again, you're going to see that three-legged stool of quality, workforce retention, and the patient experience. It's going to take all three to get us to the goal. We can't afford to ignore that. So let's talk about how TeamSTEPPS can move the needle. TeamSTEPPS can move the needle, first of all, on safety. I really tried to, I've got a lot more slides for you on just even unit specific data on how TeamSTEPPS can move your numbers, but I wanted to specifically look at the role of teamwork in patient safety during COVID-19 because there were some studies that were taking place during that time. And here's what they found. So this is a particular study out of the Journal of Patient Safety. And what they found was that there was a consistent and statistically significant beneficial connection between staff engagement and both safety culture and the rate of errors in adverse events. So statistically consistent correlation between having a positive workplace culture that had staff that were engaged and decreasing the rate of errors that they saw. So it also proposed that programs like TeamSTEPPS that increase staff engagement, their exact words is it could offer an impactful and cost-effective means of enhancing a range of patient safety outcomes. This was just a phenomenal publication in the Journal of Patient Safety on critical care teamwork in the future based on the role of TeamSTEPPS in the COVID-19 pandemic that they saw. And the article reports in detail how TeamSTEPPS changed the culture in their interprofessional team in their medical ICU. But here's just a couple of the many benefits that they found. TeamSTEPPS increased the trust and empathy that they had among team members. It improved their safety practices as a result of improving their communication, their interprofessional communication, and that because of TeamSTEPPS, that individuals felt empowered in their roles and there was a stronger cohesion between the team. And I think even more importantly, the study showed that training and implementation of TeamSTEPPS strategies, it not only withstood the challenges of the COVID-19 pandemic in their medical ICU, but it provided evidence. If you read through this study, you're going to see that they had evidence that the team strategies that they employed with TeamSTEPPS actually were retained throughout the pandemic, in spite of the multiple barriers that they were facing in this particular medical ICU every day. So it didn't just work and then it didn't. They were able to maintain the progress that they made because of implementing TeamSTEPPS in their ICU. So I think that this article in the Harvard Business Review this last spring really summed it up. Looking at actions which reduce medical error in US hospitals, it correctly, I believe, states that safety is dependent on the organization's culture. And what is the organization's culture? Really the sum of the behaviors of leaders and staff. So they said that teamwork, this was their conclusion, that teamwork, education, and training through structured initiatives, that's the most effective mechanism to improve patient safety. And when we promote a work environment where all individuals work together, that is what's going to have the most significant effect on improving patient and staff safety and staff satisfaction. It's in the data. We can prove it. All right, so let's turn the page and look at the importance of organizational culture. Organizational culture. How TeamSTEPPS can move the needle on workforce resilience and retention. And this is our hot button issue, right? We know we've got to go back and focus on patient safety culture. We've lost some ground. We know it. We've got to rebuild a culture of safety. But this workforce resilience and retention thing, that's like our up close and personal felt need right now. So how can TeamSTEPPS move the needle there? Well, the National Plan for Health, Workforce, and Well-being states that its number one priority This was an article that came out in the National Academy of Medicine just this last fall. And it said that its number one priority was to create and sustain positive work environments and culture. And then I loved this quote by Ronald Wirt. He's the president and CEO of Cottage Health, but he's also the chair of the American Hospital Association's board task force on workforce. And he says, ensuring a supportive and engaging workplace culture may well be our most important leadership responsibility. Did you hear that? Our most important leadership responsibility and our most valuable recruitment and retention asset as we move forward. Now, I've worked with teams through some pretty dark days over the last 3 years. And I can tell you that alone, we feel overwhelmed, we feel discouraged, we feel unsafe, we feel ready to walk out the door. But when we're working with a team that we can count on to pull hard for one another, we'll show up the next day. No matter how tired we are, no matter how many shifts we've had to do this, if we're working with a team that we know is going to pull just as hard as we are, that we can count on them to have our back, both the staff on the front line and our leadership, we will show up again tomorrow. So TeamSTEPPS drives culture, and culture drives retention. How? Well, number one, by creating synergy and camaraderie within the team. It's so important. By increasing mutual support, because that increases feelings of efficiency and safety, both for our patients and for ourselves in giving care. We don't want to feel like our licenses are in jeopardy because we're stretched so thin. So TeamSTEPPS increases that mutual support, which increases our feelings of safety. It increases and creates an environment where staff feel heard and supported in super practical ways, both by their coworkers and by their leaders, and by improving psychological safety with leadership, right? We know when we have a program like TeamSTEPPS as our back, we know, or as that we've implemented, we know that our leaders are going to have our back. So let's look at just a quick look at the data around TeamSTEPPS and workforce resilience and retention. And TeamSTEPPS gets it done. It gets it done. One study that I looked at was an evaluation of a TeamSTEPPS implementation in an intensive care unit, and it found that teamwork improved from the time of its initial assessment to 3 months later, and that nurses planning to stay, here you go, workforce retention, nurses planning to stay increased from 58% to 89% over 2 years' time. Another study conducted by the Department of Defense that was published earlier this year, earlier in 2023, found an association between lower burnout and high teamwork across all work areas, even in those with the highest levels of self-reported workforce chaos, right? Like the heat is on. And their conclusion was that workplace strategies that focus on improving teamwork, such as TeamSTEPPS, are super impactful for reducing burnout among healthcare workers. And what did we see in the first part of our presentation here today, right? That when you have high burnout, you have high turnover. So reducing burnout is got to be one of our key focuses. This was probably my favorite study. After 2 weeks of data piled up to my head, this was one of my favorite studies. It was a great one published this year by Brian Sexton, and I'm proud to say a barrage of AHA Team Training Advisory Panel experts entitled Teamwork Before and During COVID-19. And what it said, its conclusion was that proactive team training may provide substantial benefit to team performance and team member well-being during stressful times. And the thing that it was trying to help us understand is that we may be through or mostly through this first crisis with COVID-19, but if we like set down the baton now and we think we can like scale it back and go, whew, like glad that's over, never gonna have to do that again. Oh no, it's coming. The next crisis is coming. Where I live sets on a major fault where we know like the big earthquake, it's coming. And so what this article tried to point out was, look, if you're proactively implementing programs like TeamSTEPPS, if you're proactively getting your teams up and running with team training, they're going to be more effective, they're going to be more resilient, and that's going to carry you through the next crisis that's coming. All right, so let's quickly look at the way that TeamSTEPPS can move the needle on the patient experience. And this shouldn't be any surprise for us, right? We know that when you combine patient safety with a high teamwork culture, you get a positive patient experience. 2 plus 2 just automatically makes a 4 here. And when we don't do the math correctly, we're ending up in the minus numbers. When patients feel confident in the care that they've received, when they feel or have felt empowered to be part of their own decision making and in their journey, their own patient safety journey, when they see that the care, that the team that's taking care of them, right? When they see that that team is playing well together, that makes them feel safer. That increases their report of a positive patient experience. And as we've already established, a positive patient experience has a big impact on an organization's bottom line. So I hope that I have proven to you today, even with just this little bit of data that I've been able to give you, I hope that I've made you hungry to go check out the rest of it, because it's impressive. It's impressive. You can move the needle. You really, really can. An investment in your front line. It's going to take you the distance and high quality care, in a resilient workforce, and in a positive patient experience. So what are you going to do with that information now? What can you do? So it's time to prepare your pitch for leadership. One thing that I have learned is that leaders and CFOs, those chief financial officers in particular, they enjoy bullet points and quick hits. Quick hits. So an elevator speech is a super positive, really, really great place to start. And then once you've hooked them in, then you can expound more. But start with that quick and dirty, just getting their attention. All right. So using our framework for an effective pitch, here's what we want you to do. Number one, state the problem. And you're going to do that with both your head and your heart. Number one, your head. Use the data. And what I want to encourage you is work with your quality and risk folks. They know if you've got a unit in particular that's had a sentinel event, okay, or some patient happening, or they know what your overall quality and safety numbers are. Use the data, your own organizational data, as well as the greater system data across the US that I have shared with you. And then it's super important to connect that with the heart, just like I briefly shared. That was 3 sentences about my experience, my personal experience with medical error and what it cost my family, right? So you can tell a quick patient story, or you can tell a quick personnel story that's really hit you hard. Okay. So using the head and the heart, state the problem. The next thing you're going to do is share your big idea. Share your big idea that can move the needle on your pressure point. And that's TeamSTEPPS. Clearly, explicitly state that TeamSTEPPS can make the difference. So using kind of head and heart again, tell them what it is. Tell them what it is. It's a master training course to build your own team of trainers that will be able then to train the rest of your organization on those essential tools and concepts of TeamSTEPPS. We are all about building your internal capacity. We want you to have your own team that can go the distance with TeamSTEPPS. Now, maybe you're going to want just a little bit of sustained support from AHA to guide your master trainers in building their curriculum, helping them with implementation strategies, right? We're here to make you sure that you've got that internal capacity to go the difference. So share your big idea, what it is and how it works. And then next, describe the impact that TeamSTEPPS can make, okay? Number 1, head. I've shown you the data, gonna give you more. I keep saying it because don't miss going back for it. Use the data that shows that TeamSTEPPS works. It really does work on those 3 things: quality, workforce retention, patient experience. TeamSTEPPS works. Use that data. And then heart, again, think about a story that's going to connect their what with the why. What's the personal impact? What's the felt need that you know TeamSTEPPS can make a difference on, can make an impact on? And then lastly, outline your next steps and state your ask super clearly, okay? That might be a phone call with myself to get more logistical detail on team training. You might include a proposed timeline, who you think you should train first, maybe a unit that's had a sentinel event. And then heart, invite their perspective. Invite their perspective. And again, remember, most of the time, these are bullet point people. They're going to need some time to go back and just process it out and think it through. So give them the information, invite their perspective, and then close by helping them connect the dots by how an investment in the front line is a way that they can impact the organization's bottom line. The front line and the bottom line really can both win here. Okay, so I'm going to turn that over to Jen.
Thank you so much, Rhonda. I think you did such a wonderful job of connecting the head, the heart, the eyes, and I know there's much more head or data that was left off of this presentation that you can share later. So thank you so much for pulling all that together. I think that's such a good value add to our audience. And so I want to circle back to the big idea of TeamSTEPPS and how it works, and share a preview of the updated master training course that we've been mentioning if you've been part of our previous webinars. Just to level set, the 2-day master training course. So the first day, we still focus on the fundamentals of TeamSTEPPS. So what that means are the core TeamSTEPPS tools. Those have not changed. Day 1 of the course is we teach our audience or the participants as the learners. So they're putting on their learner hat and we're providing them a suite of tools that they could potentially use at back at their organization. But day 2 is really the portion that we revamped. And day 2 is all about, okay, now that you've learned the tools, how are you going to bring this back to your organization when it comes to facilitating TeamSTEPPS trainings, when it comes to implementing and sustaining it? And so what we've done is we've added human-centered design thinking exercises to help teams have more strategic conversations, iterate on innovative ideas, and really designing change so that when they get home, they're not scratching their heads and be like, oh gosh, that was 2 days. What do we do now? the course ends with a very specific strategic and tactical plan for participants to follow. And so when it comes to design thinking, it's really an iterative process that involves empathizing with your key audience. So better understanding who they are, their challenges, their needs, defining the problem clearly, ideating solutions, and then ultimately prototyping and testing that. So I'm going to give you a brief walkthrough of the updated curriculum. I'm going to request remote control, Rhonda.
No, Dad, sorry.
Thank you. I love technology. Okay, so the updated curriculum objectives overall, just to level set, is we wanted to reduce the lecture and increase videos and experiential learning. Like I mentioned, we're utilizing human-centered design thinking exercises to really just increase team collaboration. And so we do this throughout the second day so that you're building your plan throughout. So it's not just like we're providing you a lot of lecture and content and discussion and then, okay, you got a few hours now, come up with your plan. You're building it throughout the day now. And so that way you're leaving with that strategic and tactical plans. So really quickly, there are 4 key components or sections of day 2 that I'm going to briefly go over. And so measurement, we're focusing on the why. What is that challenge or opportunity for improvement? How can we help you clearly identify and define the problem? In the past, we were really focusing on quantitative data, but we're also really highlighting the qualitative data behind your why. And so more emphasis is on the existing data that you have and less about acquiring new data. There's data fatigue, but I'm everywhere. But we're trying to emphasize you don't need to collect more data. You have plenty at your fingertips. And throughout this module, we help you identify and draft an aim statement. And so this is one of the canvases that we use to help you get there. Moving on to building your change team. This is a new part where we're really outlining the different training models out there for TeamSTEPPS and the roles that change team members have. There are many ways to implement TeamSTEPPS in terms of different training formats. And so we start to clearly identify a few options so that participants in our course can then apply that back at home, because there's not a one-size-fits-all approach to this. And we also focus on what stakeholders are needed to be involved in the change team and really identifying their roles and responsibilities and thinking and empathizing about what challenges do they face. What are their motivations? How do we keep them engaged? And how do we create a sense of ownership of TeamSTEPPS? We move into change management. TeamSTEPPS is all about change. And so we really drill into how the differences or the commonalities rather between many of the change management models. There's 3 core models that we use. We focus in on one of them, but we have 3 at our faculty's disposal. And we have participants start to then apply that change management model to the why and their aim statement. So now we're starting to get more into the strategic part of the implementation planning. And then what we end up with ultimately is participants are able to create a 1-page strategy plan. And this is refined and worked on throughout the day so that there's a 1-pager that they can say, hey, CEO, hey, nurse manager, whoever sent them there, here's our strategic plan for implementing TeamSTEPPS. And just as important is what is our tactical plan? So the TeamSTEPPS game plan canvas you see there is what are we doing by when, who's owning it, what challenges do we foresee, what resources are needed in order for us to hit our objectives. We end the course with this really unique marketplace for peer-to-peer sharing so that those that attend can get a preview and some coaching from other participants there. So I'm really proud of the work that we've done to this curriculum because I think it really meets people where they are and provides really valuable time together to work. 2 days is a lot, and we want to make sure that that is valuable time of work time. It's not just lecture, it's not just sitting there, it's not being passive. This is an active course. So really have piloted it about 8 times plus, maybe 10 at this point. So if you are interested We have public courses coming up for the first half of the year. They are filling up quickly. The hyperlink here on the screen works, but my colleagues will also chat in a link to our course registration page. We highly, 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 highly recommend coming in teams. This should not be on one person's shoulder. So please, if you can come in a team, think about try to make that happen. We offer team discounts and that support. The other option is we can come to you and we can provide custom, what we call advisory services at your organization. So that could be us just providing a 2-day master training course, or more of a comprehensive program where we are coming and providing that master training course, providing virtual coaching, coming back and really coaching up your master trainers by co-facilitating with them, working on their implementation plan, working on their curriculum so that it's hardwired throughout their organization. As time goes on, we kind of step back more and more so that more ownership is taken upon that hospital. So that is a very customizable service that we offer. And so more information can be shared about that via the link. And then Rachel, thanks for chatting that in. So I'm going to turn it back over to Rhonda to kind of take us home here with some of our big key takeaways.
Sure. So just key takeaways, an investment in the front line has never been more important to patient safety and team resilience. I so believe this, like I can 150% take this to the bank, that this is where we're gonna start turning the needle. I saw something in the chat and I'm super sorry, we're not gonna get to all your questions today. I ran us over with data, big surprise. But one of the things I saw is, how do you convince your hospital that they don't just need to, set their people down in front of a computer screen and, have them work through a health stream or whatever your training, educational program is at your hospital. And here's what quick one-liner for that. Telling isn't training. Telling isn't training. So if you sit somebody down in front of a computer screen, you might get information. You're not walking away with transformation. Transformation happens in in-person courses, okay, where is the best. And then certainly the next option would be interactive virtual courses where they're actually present in real time, getting into chat groups and interacting. So that's how you're going to get that face-to-face interaction. You're going to get simulation. You're going to actually get to experience being trained and not just a talking head at you. Okay, they're not going to walk away changed with that. So, oh, my volume's super low. I'm so sorry. Okay, hope you heard that. Recent data supports team training is an important solution to workforce retention. It's absolutely there. Please go back and hit the data. Okay, I've got it for you. And then the combination of TeamSTEPPS tools and human-centered design leads to a fresh approach and sustainable change. So I know we're right at the top of the hour. In case you didn't hear that, just going to say it one more time. Telling isn't training. Information will not change your culture. And cultural transformation is what you need.
Thank you so much, Rhonda. Just a few closing announcements, because I know we're right at the end of time, is we will be sharing a recording of this along with the slides here and the data that Rhonda highlighted. All of the resources are at the end of this slide deck. More so, we will be offering up what we're kind of referring to as one-on-ones or office hours. So that will be in the follow-up email to you. So if you have more questions and want to talk to either Rhonda or myself, it could be anything about implementation approaches to TeamSTEPPS, questions about our courses, resources that you're wondering if we have, we are at your disposal. So we will be sending out what is called a Calendly link. So you can sign up for a 15-minute session with either one of us to have more one-on-one time. So we hope that will be helpful to you. We hope this presentation was helpful for you. And we, again, Rhonda, thank you so much for putting all the hard work into this and all of the research. So I hope everyone has a great rest of your day, and we hope to see you soon.